Well, hello and good afternoon. Welcome to another Bingham Healthcare's Be Informed webinar. I'm your host, Michael Brandis, and I'd like to thank all of our viewers and everyone who's watching us live on Facebook right now. Just please keep in mind that because this is live, if there may be a glitch or two, so just bear with us, but otherwise these tend to run very smoothly. And while you're watching, please be sure to hit like if you're enjoying this webinar, or to actually share it with your family and friends. This is also being recorded, so you'll be able to watch it afterwards in its entirety. It'll also be found on our Facebook pages, on Bingham Memorial's Facebook pages, as well as our YouTube page, I'm excited today because we're going to be talking about autoimmune diseases, and we have with us Dr. David Bielstrom, who has almost 30 years of experience. He's the director of the International Autoimmune Institute and Bingham Memorial Center for Functional Medicine in Blackfoot, Idaho. Welcome, Dr. Bielstrom.
Thank you. It's wonderful to be here.
Thank you for being here. We appreciate it. And then in addition, we have Jody Bilstrom. She's an LCSW, a licensed clinical social worker who works in mental health. She works alongside Dr. Bielstrom, helping patients from a mental health perspective. Welcome, Jody. Thank you for being here.
Thank you for inviting us.
So what I'm going to do is take a few moments to allow Dr. Bielstrom and Jody to introduce themselves, talk a little bit about their specialties, and then we are going to be answering a number of questions that viewers are actually typing in and sending us right now. So if you do have questions and would like to be a part of this conversation, please feel free to submit those, and we will do our best to answer as many questions as possible. We are here for an hour today, so we do have some time, but we have a lot of questions that have come in advance. But keep those questions coming, and we'll answer as many of them as possible. So, Dr. Bielstrom, as I mentioned, you have almost 30 years of experience. Could you tell us a little bit about yourself, perhaps a little bit about your education, and what it is that made you decide to go to medical school and then ultimately study autoimmune diseases?
Well, I went to med school at University of Illinois, and then I did my specialty training at University of Colorado. And my original area specialty was spinal cord injury, where everybody was paralyzed from the neck down and the waist down, and very complex health issues to the point where you would become their primary care physician, because just a simple over-the-counter medicine that we wouldn't even think twice about as an able-bodied person could actually kill these people. But because things were so complicated, I kept wondering, is there something else out there that can help these folks for the myriad health issues they had? And wouldn't it be lovely not to have to deal with all these side effects that we tend to get with a lot of medicines we were using? As it turns out, there has been such an explosion of scientific data over the last 20, 30, 40 years that there is so much scientific information that allows us to not only reverse chronic disease and prevent chronic disease, but tells us exactly why people get chronic diseases like autoimmune disease. And I saw a real need in the autoimmune disease because the number of people that get the autoimmune disease has just skyrocketed since I was in med school. So back then it was 1 in 400 people got an autoimmune disease. Now it is 1 in 12, 1 in 9 women. Estimates are that 50 million Americans have an autoimmune disease. And these numbers are growing more and more, including we're finding out that a lot of chronic health issues that we did not necessarily think had an autoimmune component actually do. And the autoimmune component to these diseases is the immune system becomes confused and actually starts attacking our own body parts, which is so counterintuitive. Our bodies should be able to fix anything. We stub our toe, it may hurt like crazy, but you don't think you're going to have a bad toe your whole life. You know your body can fix this. Give it 2 or 3 minutes, you're good. You just try not to kick that chair leg ever again because it really hurt. So when the body actually starts attacking itself, that is just so crazy. But we know why this happens nowadays. And with that, there's testing that can be done to find out why it happens for each individual. And then it puts us in a good position not only to reverse the disease process they already have, but also try to prevent people from getting new autoimmune diseases or other chronic diseases as time goes on. Like I mentioned, more and more diseases seem to have this autoimmune component to it. So like You can have autoimmune disease where you're attacking body parts. You could attack the lining of the blood vessels of your heart and your brain, and that's tied into heart attack and strokes. You can be attacking your bones, there's osteoporosis. You could be attacking your brains, there's Alzheimer's. You can be attacking things like, I just love this term because it just kind of tells you how much we know about this stuff. There are these things called voltage-gated potassium channels in the nervous system. And so if you attack the VGKCs, you get migraines, seizures, neuropathies, all those kind of things. And so we go, wow, if you're taking care of these autoimmune things, you're taking care of a lot of stuff. And what we do, which is totally unique, usually people are just offered medicines that kind of put a bandage on the problem, a little bit like a bandage on a bullet hole, where we actually go, okay, yeah, the medicines can be helpful as a bandage. We're going after the bullet hole. We're going after the exact reason, where all the damage has come inside, so we can fix how people feel, but also actually get rid of these autoimmune diseases and ultimately not require the use of medications a lot of the time that are more the bandages, but also medications tend to have side effects over time as well.
Well, thank you, Dr. Bielstrom, for elaborating on that. That's absolutely fascinating. One of the things that is, now you're saying that chronic diseases are becoming extremely prevalent in not only in American society, but around the world. I think you mentioned 1 in 12 people, and what struck me is then you said 1 in 9 women. So it seems like autoimmune diseases or chronic diseases are disproportionately affecting more women than men. Is that accurate?
That's very accurate. Actually, 80% of people that get autoimmune disease are women. And there's a couple really specific reasons why we think this happens. One is something called estrogen dominance. And this is when a woman has too much estrogen, not enough progesterone. And that creates a lot of health issues, such as bad menstrual flows, bad menstrual cramps, premenstrual syndrome, ovarian cysts, fibrocystic breast disease, fibroids, endometriosis, infertility, but also insomnia and anxiety. And so you look at those kind of things in women, you go, okay, I know somebody's got estrogen dominance, but estrogen dominance is such a huge driver of autoimmune regulation issues. So not only the upregulated, overactive immune system issues such as autoimmune disease attacking body parts, but also underactive immune system issues, cancer, breast cancer. So for example, women with estrogen dominance premenopausally, they get a lot of autoimmune disease, but they also have a 5.4 times greater chance of getting breast cancer.
Wow.
And a 10 times greater chance of getting any malignant neoplasm in their lifetime, the cancers that travel and are just terrible. And so this estrogen dominance is such a huge driver of many chronic diseases, not just the autoimmune thing. And then the second thing that we've seen is that in every cell in our body, we have DNA. Now, we used to think the DNA was hardwired. Whatever genes you got from your parents and grandparents, you're stuck with it. Good, bad, or otherwise, you're kind of stuck with it. But we know now that's not the case. It's actually not so much what genes you have, it's which ones are turned on and turned off. And unfortunately, there's a lot of bad genes that have to be turned off and a lot of good genes that need to be turned on in order to prevent chronic disease. Well, actually, there's a lot of bad genes on the X chromosome. And women get 2 copies of the X chromosome, and men get 1 copy of the X and 1 copy of the Y. Well, it turns out there's a lot of bad genes on the X chromosome. So for a woman to maintain health, avoid autoimmune disease, for example, a woman has to shut down 85% of that second X chromosome. Otherwise, all this bad information is being given to the body, driving autoimmune disease. But it's another reason why, just kind of in general, along with the estrogen dominance, women have such a more complex time trying to maintain health than men tend to have.
Okay, thank you, Dr. Bielstrom. Just wanted to mention that throughout this webinar, Dr. Bielstrom and Jody Bielstrom are going to be going into a lot more depth about chronic diseases, autoimmune disease, and how it affects from children all the way up to adults. But also wanted to let you know that at binghammemorial.org, again, www.binghammemorial.org, if you go to our website, you can look up their bios for more information about each of the providers with us today. And also, there are a lot of other videos and there are a lot of other articles that have a lot of really great information that Dr. Bielstrom has compiled throughout the years working here in Blackfoot. And also, if you look for it, he has his own website as well. It's Dr. Bielstrom, drdavidbielstrom.com. I believe, is that correct, Dr. Bielstrom?
Yeah, drdavidbielstrom.com.
drdavidbielstrom.com, and he keeps a blog. So there's a lot more in-depth information that you can find that you may not, that we may not be able to get into or be able to broach in today's webinar. I'd like to take a moment to shift and introduce and welcome Dr. Jody Bilstrom. Again, thank you for being with us today.
Thank you for having me.
Jody is an LCSW, which is a licensed clinical social worker. She works in the mental health profession. Jody, why don't you take a few minutes to tell us a little bit about yourself, perhaps a little bit about your education, and what it is that inspired you to go into the mental health profession?
Sure. I got my undergraduate in social work at the University of Wisconsin and my graduate degree, my master's in social work at the University of Illinois. It's very ironic today that I'm doing what I'm doing. Little did I know that the whole reason behind my coming into social work and the mental health profession really had a close place at home. My dad suffered from mental health issues as I was growing up and had childhood traumas in his life that resulted in these mental health issues. And as it turned out, when he was dealing with some of these, he had a wonderful counselor that he went to that helped him work through some of these issues. We came in as a family and helped work through these issues, how it affected all of us as well. And I really was impressed by what this gentleman was able to do to help us, to help my dad. And so it really led me to want to look into this and ended up being the profession I ended up pursuing. And ironic that it was my father's childhood events, his trauma, that led me to meeting someone that really influenced my career.
That's fantastic. Thank you for sharing that, Jody. And again, Jody and Dr. Bielstrom both practice in Blackfoot, Idaho. I wanted to mention that in addition to practicing in person in Blackfoot, since March, Dr. Bielstrom and Jody have actually been very involved with our telehealth medicine program. They both are seeing patients via telehealth, and I just wanted to, which is, for those of you who may or may not know, it's an opportunity for a provider, for one of our providers, to be able to speak to a patient over the phone or online if they're uncomfortable coming into the office, or if there's perhaps a follow-up that could be easily done over the phone as opposed to having to come into the office. And I know that in particular, I can say this for Dr. Bielstrom, that in addition to just seeing patients locally here in Eastern Idaho, he actually sees people from around the country in this very way. Dr. Bielstrom, would you like to elaborate on how the telehealth visits have been working for you and what your experience has been with those?
Yeah, I think the telehealth visits are great. Typically, like Michael mentioned, we see people from around the country. So like the week before COVID really kind of struck, we had 3 new people come to visit us from Alaska, for example. And so we see people from Hawaii and Boston and New York and Miami and every places in between. And we're really the only teaching hospital in the country that specializes in reversing and preventing autoimmune disease, and as far as I can tell, kind of in the entire world. And so people come to visit us. Ideally, we need to lay eyes on people once a year. We can do everything else over the phone. When we want to put together a medical tourism practice where people can come visit us, had to be someplace that's really fun to visit. And out here in Southeast Idaho, it is so fun. Jackson Hole, Sun Valley, Big Sky, Yellowstone, Salt Lake City, Snake River coming through the middle. So it's a great place to come once a year for a couple of years. We get you all turned around. Everything's great. Well, with the telehealth, it's really nice because we get to see more people from farther away and do it online, but face to face, which is really lovely. So it's allowed us to do a lot of face to face visits with people that would have found it challenging to come in to the office for a face to face visit, both for protection against COVID infections, but also it's a lovely way of doing it. So I'm hoping that one of the positives that will come out of the whole COVID-19 issues is insurance companies will allow telehealth visits to continue long after we're hopefully eventually done with the COVID-19. It's just a lovely way to do it, and will allow us, I think, to see even more and more people from far away, because they might not even need to travel out here to see us. We can actually do it all over telehealth visits.
Oh, thank you, Dr. Bielstrom. That's excellent. And Jody, I'd actually like to ask you the same question. How have you been able to use telehealth visits with your patients, and how has that been working?
Yes, I have. And actually has been a wonderful way to keep in touch with people that are struggling with and feel the anxiety of coming into the office and for safety reasons. You know, a lot of what I do, most of what I do, involves connecting with people. So it is really important through all of this pandemic to be able to still connect. So whether it's coming into the office or through telehealth, I've been able to reach out to people who do have these fears and anxieties and struggling with the pandemic, to be able to talk it through, process their emotions. So it really is about how to be able to maintain that connection with them. And so this has helped. A great deal of my patients have had a lot of anxiety with the pandemic, COVID, fears of contamination. So we have been able to process through telehealth, and this has relieved a lot of stress for a lot of our patients. So I really appreciate this connection.
Okay, that's great. Thank you for being able to do that, and for being able to help people continue to focus on their mental health, even though there's a lot of other things going on. I know it's still important that people focus on their overall health during these times. So I wanted to go into the next portion of this Bingham Healthcare's Be Informed webinar, which is we're going to be taking viewer questions. We already have some questions that people have submitted in advance if they've seen the announcements for this webinar on our Facebook pages. And then we also have people who are watching live right now that are asking us questions as well. So we're going to transition into this portion. And I do want to just preface this by saying that while Dr. Bielstrom and Jody will be responding to questions during this Facebook Live webinar, please just know that this information is neither intended nor implied to be a substitute for an in-person or telehealth visit or professional medical consultation. You just always want to be sure to seek the advice of another provider to fully address any questions that you have about a medical condition. I know that Dr. Bielstrom and Jody will be able to do their best to answer everyone's questions, but again, we just wanted you to take that with a grain of salt. And know that there should always be follow-up so that there can be an analysis and dig much deeper into everything that may be going on. So actually, one of the first questions that we have that's just come in that ties into telehealth, someone has just asked this question on Facebook is, and I don't know the answer, so I guess that's why I'll ask it. Dr. Bielstrom, a viewer is asking, is it possible to actually get in to see you a little bit earlier with a telehealth visit as opposed to an in-person visit? Although I imagine that's circumstantial, but wanted to throw that out there to you.
It definitely could be. Typically, being the only ones that are doing what we're doing, is there can be a fairly significant wait time for new patients, but being flexible and, there's a cancellation at the last minute, can you come in? That may be something that would be doable for somebody who's really close to our office, but not so much for somebody flying in from Alaska. Hey, can you come in 6 hours, or can you come in tomorrow? It's just not going to happen. So with the telehealth visits, it definitely can be, particularly because there can be a lot more flexibility where, somebody's willing to get in front of their computer at home or their cell phone, we can get connected. And it does, and so it's really nice. We've got a chance to get some people in that might otherwise have had to wait for a while.
Okay, thank you. And if you are interested in scheduling an appointment with Dr. Bielstrom or with Jody Bielstrom, I know this number is going to be coming up on the screen, if not now, a little bit later. But I will say that you can call 208-782-2444. Again, the number to reach Dr. Bielstrom and Jody Bielstrom's office in Blackfoot is 208-782-2444. Okay, so moving on, another question, Dr. Bielstrom, that we have is related to skin problems. We have a viewer asking, does autoimmune disease cause skin rashes on the body and face, and can it cause holes in the face?
That's a great question. So one thing is there is such a tight connection between the skin and the gut. One of the videos that's available, the places Michael mentioned was the gut-skin connection. So whenever you see skin stuff, I'm always wondering about the gut. Now, the gut is a really big central mechanism when it comes to chronic disease in general, including these autoimmune diseases. So when the gut's off, it tends to create vitamin deficiencies because you can't digest your food well and get the nutrients out of your food. It tends to throw off all your hormone balance. It tends to negatively impact the immune system in general. Thus, you get these infections. It tends to make it hard to get rid of toxins from the body, and they accumulate, driving autoimmune disease. And there's ever so many things the gut does. And so when you see the skin stuff, you think, what's going on in the gut? You fix the gut, you fix these other things, and actually the skin issues tend to clear spontaneously pretty much as you fix the gut and you fix the underlying mechanism. The skin just kind of tends to be that outward signal that, yeah, something's going on the inside that we need to fix, and we can fix it. Every organ system can get better, including the skin can get better.
Okay, thank you, Dr. Bielstrom. Then another question that was related to sweet syndrome, and I have actually never heard of this, so I'll be interested to hear what you have to say. We have a viewer saying that they were diagnosed with sweet syndrome. They have been to doctors in Pocatello, Idaho, and now they are seeing a provider in now a sugar house in Salt Lake City, Utah. They have been on a number of medications. They are lost and exhausted. Do you have any ideas, or how would you respond to this viewer?
We have some great viewers. This is some great questions. Yeah. And so this illustrates another really big central concept in how disease occurs, but also how you can reverse chronic disease. So sweet syndrome is a skin issue you tend to see in people with immune system issues, both the upregulated and the downregulated. So people with sweet syndrome tend to have autoimmune diseases or tend to have cancer, such as leukemias. And so with that immune system dysregulation, the things that create this immune system dysregulation are such central mechanisms in chronic disease in general that typically we talk to folks about whatever is causing your autoimmune stuff is causing everything else. We can fix the autoimmune stuff, you're going to fix all the other stuff all by yourself. So it's a little bit akin to fibromyalgia and things like rheumatoid arthritis, where at least 40% of people with rheumatoid arthritis and those type of autoimmune diseases end up being diagnosed with fibromyalgia, which is a chronic muscle pain of greater than 3 months duration involving 3 of the 4 quadrants of the body. You have fibromyalgia. Well, whatever's causing the autoimmune stuff is causing the fibromyalgia. Whatever's causing the autoimmune stuff, immune system dysregulation, is causing sweet syndrome. And that's why they're so tied in, because there's such a tight connection between those couple things and the autoimmune process, immune system dysregulation, that you may be looking at, well, what's causing the fibromyalgia, what's causing the sweet syndrome? Let's kind of look at that when really what you need to look at is, so what's creating this immune system dysregulation? Do the proper testing, get the right data, make the right changes, and allow somebody then to reverse the process that's driving not only sweet syndrome and fibromyalgia, but also immune system dysregulation.
Okay, thank you. I hope that helps our viewer. Thank you for your interest in our webinar and for asking that question today. Hopefully that'll help other people who may be in a similar situation. Another question that we have from a viewer is related to diverticulitis issues. They ask, I have been diagnosed and had part of my intestine removed. I also feel like my body has inflammation and always feel like I am in pain. Are there specific items I should be changing in my eating habits?
We got some great questions. Yeah, so diverticulitis, you say, well, there's something going on in the gut, right, the intestines. There's tests to be done to can figure out why that is. Now, diverticulitis in some respects is just inflammation on the walls of the intestines, and the inflammation creates sort of weak spots, and you start getting these pouches, and then the diverticulosis is the pouches because of the weak spot in the wall, and then when they get inflamed, which is the itis, you get diverticulitis, inflammation within these pouches. So you got gut issues, and a big problem when you get gut issues to start with, kind of long before the diverticulosis litis part, it usually takes years or decades to actually be bad enough where somebody goes, oh, you got this disease. So the inflammation that was the precursor for the diverticulosis and diverticulitis will create what they call an intestinal permeability disorder, where you actually get leakiness between the cells of the intestine, and then things that are in the gut that should not be in the gut, or things in the gut that should never get into the bloodstream, get into the bloodstream. They should go in the toilet. They get in the bloodstream and really create problems in the body, including it creates food sensitivities. And there's ways that foods bug people, kind of two main ways. One's kind of immediate, and the other is delayed hypersensitivity reactions. So the immediate hypersensitivity reactions to foods are, I eat this food, and every time I do, I feel crummy enough, quick enough, that I know this food's bugging me. And actually, people are better at figuring that out than any test we have. The real sneaky part, though, is people can also develop these delayed hypersensitivity reactions to food. This is when you eat a food, and days later, or maybe even 3 to 4 weeks later, you get some inflammation produced. Now, if you don't know the food's bugging you, because it's not bugging you right away, people keep eating it, and that inflammation just grows until you go, holy cow, I got inflammation all over my body. Kind of like this viewer was asking. It's inflammation everywhere, not just the intestine. And so when it comes to autoimmune disease, we know that every person with an autoimmune disease, no matter what kind you got, everybody's got problems with the proteins in wheat. There's actually 62 different proteins in wheat that bug people in this situation. Gluten is just one of them. And you have a problem with sensitivity to the proteins within cows, milk, dairy products. Butter tends to be okay because it's a really good fat, but it's all fat that's not really the proteins. So anybody with an autoimmune issue, they got a wheat, gluten issue, cows, milk, dairy. That being said, you can get a whole bunch of other foods bugging you over time, and there's testing that can be done to identify what foods those are. You get rid of them temporarily, you can then fix the gut because you don't have foods bugging the gut anymore. You can fix all the gut symptoms, but because the gut's the central mechanism, you're going to be fixing that systemic inflammation that's all over the place, which tends to develop in multiple organ systems once the gut gets disrupted enough. So you can actually reset these sensitivities, because by fixing the gut, you're going to be fixing the reason why these sensitivities happen in the first place. And even with autoimmune disease, you can get rid of pretty much almost all of these sensitivities over time. The one you're kind of locked into with autoimmune disease is the wheat and gluten. But if you don't have an autoimmune disease, you just have chronic disease not associated with autoimmune disease, you could even reset the wheat part along with all the other foods.
Okay, thank you very much for that response. I'd actually like to take a moment to bring Jody Bilstrom back into the conversation. We have a couple of viewer questions related to autoimmune disease and chronic diseases in children. And I thought I would talk to Jody about something that she specializes in. And it's how adverse childhood events can actually trigger or cause autoimmune diseases or chronic diseases to affect someone. So, Jody, first of all, could you talk to us about how you would define what an adverse childhood event is?
Of course. Adverse childhood events are events that occur in a young person's life that have a serious negative impact on their health as years go by. So it is important to know if these events have occurred, thus we want to screen for them. It is real important that when we are treating someone's medical issues physically, that we also look at the mental health issues, because stress, high levels of stress, can highly impact a person's physical health as well. So I use a screening tool when a new patient comes to us in our clinic, and it is made up of 10 different traumatic events that could occur in childhood. And what those 10 events are, I'll go ahead and list them so people are aware, and how significant this is on a child's life and then thus in adult life, how it affects their health. So the screening tool, like I said, is made up of 10 events, 10 traumas, and we ask the question if these have occurred prior to your 18th birthday. So the first one is physical abuse. Did a parent or another adult in the household often swear at you, insult you, put you down, or humiliate you in a way that made you afraid or that you might be physically hurt? 2, emotional or verbal abuse. Did a parent or other adult in the household often push, grab, slap, throw something at you, or even hit you that would leave marks or injuries? 3rd is sexual abuse. Did an adult or a person at least 5 years older that ever want to touch or fondle you or have you touch them in an inappropriate sexual way? Number 4, emotional neglect. Did you often feel that no one in your family loved you or thought you were special or important, or that the family didn't look out for each other? Number 5, physical abuse. Did you often feel that you didn't have enough to eat, had to wear dirty clothes, or had no one to protect you, or that your parents were too drunk or high to take care of you? Number 6, parents' divorce. So were your parents separated or divorced before the age of 18? Number 7, witnessing physical abuse of mom. So was your mother or stepmother often pushed, grabbed, slapped, or had anything thrown at her, or sometimes kicked, bitten, hit with a fist or something hard, and repeatedly to the point that it required a hospitalization or a visit to the ER? 8th is apparent substance abuse. So did you live with anyone in your home with that was a problem drinker or alcoholic or had used street drugs? Number 9, depression or mental health issues. So was anyone in the household depressed or mentally ill or ever attempt suicide? And the 10th is incarceration. So did a household member ever go to prison? So these are just yes or no, 10 questions, 1 page. But the scoring is that with each trauma, with each event, there's 1 point if this has occurred. So it is critical to look at that if someone scores 4 or more of these events in their childhood, they have a 70% chance of developing a chronic illness when they're an adult. So this is very critical to look at these adverse childhood events to see how much stress this adult now suffered through childhood and how that has affected their physical health.
Thank you, Jody. I know that people watching some of those questions that actually might be really difficult, but it's really interesting how the body. It's really when they talk about the mind, body, and soul is really interconnected, and with understanding and being able to confront these events and be able to address these can actually really be life-changing in children, teenagers, and adults, and really help to have you to completely change the way that you're living your life. And again, if there's something that you would like to talk to Jody Bilstrom about or schedule an appointment for mental health, her phone number is 208-782-2442 or 782-2444, and she can continue to elaborate on that. Now, Jody, I know that after you screen for adverse childhood events, and there's a lot of other issues that you help people to deal with and to kind of and to work through. I wanted, and I know this is a little bit of a general question, but just wanted to maybe help our viewers to get a better understanding of what it is, how it is that you treat your patients. Sure. And I wanted to say, how would you start working with a patient who has faced an adverse childhood event? What are maybe some examples?
Sure, of course. And I want to add, when I read these 10 events that we look at, I know some of them just hearing it is hard to hear, hard to listen to, but it's real important to explain it, to be very specific, because it is hard for some people to admit to this, to take this on. There's a lot of shame involved, a lot of embarrassment. They feel it's their fault when these events occur in their childhood, and really they had no control over these. They were very young, and so it is important because it has to be said, it has to be explained. So I just want to say that I know these are hard to hear, but it is very important.
Thank you.
So as far as treatment, of course, the number one modality we look at is psychotherapy. So I have office hours, like you've explained, where I have patients come in and we try to work through some of this trauma, some of these things they didn't even realize was trauma, and how this stress was impacting them. So cortisol is a major issue. This affects a lot of anxiety. And so we try to dampen that. So I like to help patients come in and we start using guided meditation to help them learn to calm themselves down. So with psychotherapy, guided meditation, guided visualization, Dr. Bielstrom also does acupuncture. This helps reduce anxiety. Many treatment modalities, EMDR, mindfulness, yoga. And that also, even now in the time of this pandemic, going online, there are apps for your phone that you can download. So if you're not in a session with me and we're doing a guided meditation, there are many ways to do this on YouTube, on specific apps. I like an app called Insight Timer that has 45,000 free guided meditations to help patients to be able to calm themselves down so that this will also help their physical symptoms. If they can reduce the stress, we see a lot of symptoms reduce when they're able to start doing this.
That's great, Jody. And I wanted to touch on this a little bit. You mentioned the word cortisol, and I know Dr. Bielstrom, I'll circle back to you in a second, because I know you do a lot of work about cortisol levels in people's bodies and how that kind of can have adverse effects on someone's immune system. So would you describe cortisol, Jody, as it's a chemical that actually it's a chemical there's an excess of that chemical in someone's body that
Yes.
causes anxiety and stress. Is that correct?
Well, yes. So cortisol is the stress hormone in our body. And so what happens is a lot of people, when they come in to see Dr. Bielstrom or myself, they're really, their cortisol gets stuck in the on position. We call it the on position. So it's almost like the fight or flight mode has kicked in. They always feel like the bear is chasing them. It's a constant state of hypervigilance when that cortisol is off balance. And so it's real important to address this stress hormone. And Dr. Bielstrom can address that more as far as how he does that physically with patients. But for my patients, it's really about, they have a very hard time because of the cortisol being affected. They're always, like I said, in that fight or flight. So they have a hard time even recognizing danger or fear. They've felt so stressed for so long that they struggle with being able to even recognize it. So we have to, that's where the guided meditation comes in, to be able to help them begin to understand how to calm themselves down. Very critical to helping then reduce their physical symptoms. So
Okay,
very important.
Thank you, Jody. And I'll actually shift over to you, Dr. Bielstrom. I know that I've worked with you and would like to hear how you would like to talk about cortisol levels in someone's body. And then the other thing that I think is important is when Jody talks about guided meditations, I've done guided meditations for maybe 15 years and for a long time, and yoga, and I never really understood I knew that it was like turning my brain, like as a computer, turning my brain on and off. It was kind of like a reset button to kind of be able to quiet any thoughts. Guided meditation personally helps me to do that, but I never knew any scientific reasons for or the benefits behind meditation, and or like a yoga, for example. And I've learned through Dr. Bielstrom that actually doing a guided meditation or yoga, if you think about this, it actually helps to develop chemical or produce chemicals in your body, even if you do it a few times a week, that actually that help to inject anti-inflammatory chemicals, natural anti-inflammatory chemicals into your body that then helps to calm your entire body. Now that's my layman's way of expressing it. So let me turn it over to you, Dr. Bielstrom, and let you elaborate on this topic as you'd like.
Oh, fantastic. Yeah. So we had just touched on previously about turning on good genes and turning off bad genes. And so disease isn't so much what genes you have, it's which ones are turned on and turned off. And so ideally, everything that is good for us turns on the good and turns off the bad. Things that are bad for us turn off the good, turn on the bad. And so excessive stress, cortisol kind of being stuck in this on position, fight or flight mode, life or death mode, it creates a ton of bad gene expression. The whole thing is epigenetics, the things that influence genes. And so when the genes get turned on and off the wrong way, it just creates problems in every cell in the body, because every cell has DNA, and every cell functions based on what the DNA tells it to do. So if it's telling it bad information, you get bad cells in every organ system of the body. But as we're fixing these things, so like what Jody's talking about, like guided meditation, music therapy, repetitive prayer, all these different kind of things, you're basically resetting your epigenetics. You fix a vitamin deficiency, you reset your epigenetics. You fix a gut issue, you reset it the right way. You get rid of the foods that are bothering you, reset it the right way. So as people are healing from these autoimmune diseases, reversing the whole process, and chronic disease in general, they're basically resetting their epigenetics. So now every cell is being told the right information. And ideally with the adverse childhood events, those create such profound negative impact on epigenetics, thus driving chronic disease, not only start in childhood, where you could see autoimmune disease and depression and ADD and all this other kind of stuff in childhood, but also as an adult. So ideally, as you're trying to fix these physical things in the body that have thrown off epigenetics, or the adverse childhood events that have thrown off epigenetics, what we really teach people as part of our preventing chronic disease, not just dealing with it when it's there, is if you can set the epigenetics in a good place by age 19, you just don't tend to get chronic health issues as an adult. Thus, the very best time to prevent breast cancer is before age 19. Also, if you can set the epigenetics in a good place before conception, you're actually passing on cleaner genes the next 4 generations. It has this impact multiple generations. The corollary is that people don't know this stuff and don't know to set it the right way in the father and mother before conception. You're actually passing on crummier genes the next 4 generations. So all the chronic diseases that we're dealing with now with children and adults, huge increase in autoimmune disease, for example, but also in children, you see a huge increase in autism spectrum disorder, developmental delays. Everybody's got ADD, so much in the way of asthma, all this kind of stuff. It's really this epigenetic stuff coming from the previous generations. And the impact of this is so profound that a few years ago, Harvard got wind of 2 different studies that suggested that if you do meditation, relaxation techniques, you could reset epigenetics. And the second study was done in India. Well, Harvard said, well, this is interesting. We got to do the quintessential study on this subject, and we're going to get our top researcher on this thing. So what they did is they took this huge group of people that had done some form of relaxation for daily between 3 and 27 years, progressive muscle relaxation, guided imagery, repetitive prayer, yoga, meditation, Tai Chi, all these different ways of doing it. And then they took another group that had never done this stuff, and they checked their gene expression, which genes are turned on and turned off. Well, between the 2 groups, there was about 2,000 genes that were expressed differently. And they go, oh, that's kind of interesting. So now what we're going to do is we're going to teach these people that have never done any of this stuff, we're going to teach them how to meditate. And we're going to ask them to do it 30 minutes a day, 5 days a week, for 8 weeks. Then we're going to recheck the epigenetics. 8 weeks later, they rechecked it, and of the 2,000 genes that were expressed differently originally, about 500 of them had reset in the people that started doing the meditation. They were now expressed the same as these long-term relaxation people. And the researchers go, wow, this is fantastic. So what do those genes do? Well, those are the genes that code for inflammation in the body. And if you get inflammation, excessive inflammation in any place in the body, there's a chronic health issue. If you're not coding for these pro-inflammatory things, you get rid of inflammation. Kind of like Michael mentioned, you can actually make these things better that get rid of all this inflammation. And so the Harvard researchers go, wow, this is profound. These epigenetic changes that we're seeing in these people that do the meditation, these are the epigenetic changes you want to make if you're trying to prevent heart attacks, strokes, cancer, Alzheimer's, depression, anxiety, diabetes, autoimmune disease. This is profound. Now, what I think is even more profound than this super profound thing I think I'm already saying, so Jody's work is super important, right? He's doing this kind of stuff, but it only took 8 weeks. It wasn't like you got to do this stuff for 27 years to see the benefit, and it's so hard sometimes to make lifestyle changes. Well, I'm so busy, I got this stuff, I can't start it now because I just won't do it more than once or twice a week. I'm going to wait till later. Or I'm not going to make these food changes. I'll wait till later because it's just kind of complicated. Holidays are coming up. But within 8 weeks, you get this profound change, including Harvard had asked these people to meditate 30 minutes a day, 5 days a week for 8 weeks. And you think if anybody could get somebody to do it that way, it would be Harvard, and they're only asking them to do it for 8 weeks. But in the middle of the study, which I thought was really neat, on average, these people only did it 15 minutes a day, 3 days a week. Even Harvard can't get people to do it perfect. But the take-home message is you don't have to be perfect. You just have to be perfect enough, and you get these profound changes in the epigenetics in chronic disease.
Well, and I want to add to that,
Okay.
what Dr. Bielstrom had just mentioned. It is very true. It's very hard for some people to take on this modality of guided meditation. So with my patients, I even suggest we start out very slowly. It's 2 minutes twice a day. Because if you go into it and say 20 minutes, like Harvard study says, 30 minutes every day for a week or 5 weeks or whatever they're asking for 5 days, people will start doing it, but their mind wanders. They're not able to concentrate yet. They don't know how to slow their mind down. The stress is still too strong. The cortisol is still affected so greatly. And so we begin with very small amounts of time and build on it. And they are able to handle this much better and see the effects. They see successes. They're able to slow their mind down for a couple of minutes, so then they can add a minute every time they see themselves improving and being able to master it. So we start out very slowly, so it's something they can do and feel positive about. It doesn't have to take up that much time initially, but we build on that.
Okay, thank you, both Dr. Bielstrom and Jody. We have a number of other questions that I'd like to get to that have been coming in. The next one that we have is about juvenile arthritis and food. A viewer has asked, my daughter was off all top allergy foods for several years. During that time, she developed juvenile arthritis. I have observed how eating certain foods can cause arthritis to worsen, but with my daughter, it didn't make a difference. Is there something I am missing, or how do you determine what foods a person needs to avoid? I know you touched on that a little bit earlier. Is there anything else that you would like to add on to that question?
Oh, very much so, yeah. This viewer is absolutely right. Foods are big drivers. When foods are bothering somebody, big drivers of inflammation, excessive inflammation, and chronic disease, including autoimmune disease. So there's a lot of different sort of nutritional plans that are designed to reverse chronic disease and prevent chronic disease. And so you may hear like the FODMAP, the autoimmune diet, all this other kind of things. And there are people that make those nutritional changes and feel great and reverse disease and prevent disease. There's other people that do it and they go, it didn't work for me. Well, one thing is we're all such unique individuals. One size never fits all. So we always got to take these chronic health folks and individualize treatment. You really treat the person, you don't treat the disease. And by treating the person who has the disease, you're in a really good position of getting rid of the disease. And so typically if somebody does a nutritional plan of some type and they go, oh my gosh, I felt so much better, I go, you nailed it. You got rid of all the foods that are bugging you. If somebody does it and goes, yeah, it didn't seem to help, well, everybody's such a unique individual. The odds were those are foods that needed to be taken out, but everybody being so unique, you probably have other foods bugging you. I know for sure you have other foods bugging you too, for sure. And so it's not that the foods aren't bothering the person, it's just that by taking out sort of the ones that tend to bug people, you're not there, you got some other things going on food-wise, and that's where the tests can be so helpful, like I mentioned, for that delayed hypersensitivity reaction to foods, where you test and you can pick out exactly what foods are bugging each individual person, and then you get them out, and you may go, oh my gosh, that food's bothering me? Nobody ever mentioned that can bother somebody. Well, it's not very common, but it is present in you. You get rid of the things that are bothering you. Now you go, oh yeah, now I see where eliminating certain foods are going to have this profound impact on me. I just thought it didn't matter because we tried it and it didn't work, when it really truly was, there were still some things I was eating that were creating all this inflammation and driving chronic disease. Identify those foods, get rid of it. Now you're on your way.
Okay. Another question, and I know you saw this. This ties into a little bit about what you were talking about as well with diet. But I thought it was important. A viewer had asked about their 17-year-old daughter being diagnosed with ulcerative colitis, and she wondered because she had traveled out of the country twice last year, and another one of her children was treated with a parasite. I wanted you to be able to take a moment to talk to that parent about wondering if her daughter does have a parasite, even though her stool samples have come back negative. Is there any other additional information you'd like to provide to that viewer?
Yeah, thank you for this question. Chronic infections are huge drivers of autoimmune disease, whether they're infections within the gut, the intestines, for example, or infections throughout the body, such as some infections go attack the brain, you get multiple sclerosis, some infections go after the joints, rheumatoid arthritis, some go after the gut, and you get the ulcerative colitis and the Crohn's and the celiac disease. So we're always really highly suspicious of some kind of sneaky infection getting in when people develop these autoimmune diseases. Now, there are some infections that we're more used to that are really obvious. We know we got an infection, so like a bladder infection in women or a pneumonia, you know you got an infection. There's other bugs that are real sneaky. They basically get into the body with these cloaking devices, and they can hide from the immune system so you don't know you got an infection. But over months, years, decades, it starts creating all this inflammation, driving autoimmune disease and chronic disease. And so oftentimes, a bad bug can get into the gut and not only disrupt the gut, but the gut being the central mechanism can disrupt everything. So there's certain kind of infections you can test for traditionally through the hospital or through most labs. But that's only a small subsegment of the number of bugs that can do it. So like parasites, for example, is one of those kind of bugs that can get in there. You also see H. pylori, C. diff, these other kind of things. And so we always ask people that come in to have those things tested for, because it is highly likely that that's where it's at. But not everybody. Everybody's so unique. So even a sibling could have a parasite, oh, that's your bug that got in the gut, but somebody else has mold, a bacteria that would not be typically tested for. So there's advanced testing called digestive stool analyses that will test for kind of basically all the other infections you can possibly get, and as well as test for a lot of really important information regarding the gut that allows us to be in a position to fix the gut stuff and fix the autoimmune stuff, including fix the autoimmune disease of the gut. But if you don't see the parasites, it doesn't mean there's not other infections. That being said, we see a lot of people with parasites and other things. So they may be treated for a parasite and go, well, I feel better, but I'm not great. And I didn't really reverse things. Well, here's probably a bacteria or a mold, a fungus that got in there too. Yeah, I feel better getting rid of getting rid of this parasite, but these other dudes are still whacking everything. And I'm never going to feel my best unless you identify all the offending infections, get rid of all of them at the same time, then you really get the bang for your effort.
Okay, thank you, Dr. Bielstrom. And I just wanted to let Jody and Dr. Bielstrom have about 5 more minutes. We do have several other questions that have come in. And I just wanted to ask you this is one that just came in, Dr. Bielstrom. What advice would you give someone who was just diagnosed with MS, multiple sclerosis?
Oh, very good question. Yeah. MS, autoimmune disease, attacking of certain parts of the brain. Now, for all autoimmune disease, we're using a lot of low-dose naltrexone. So naltrexone at high doses, like 50 to 100 milligrams, are used for help people with addictions to stay away from the things they're addicted to. At low doses, more like 1.5 milligrams, 3.0, 4.5, totally different impact on the body. it's been shown to rebalance the immune system. So not only are you getting rid of the upregulated things like autoimmune disease, helping reverse the autoimmune disease, but you're helping get rid of the infections that are part of the process, and you're getting rid of cancer risk. And it gets rid of pain, and it gets rid of inflammation all over the body. And wherever there's excessive inflammation, you got your health issue. You want to get rid of that. It helps wonderful for the brain, even to the point where they see autistic children's brains doing a lot better on this low-dose naltrexone, and it can help you lose weight. And so we're using, and one of the first places they used a low-dose naltrexone years ago, I want to say decade or two, was in MS. And then they go, wow, this helps MS a lot. Geez, all these autoimmune diseases are really just one big disease. They just attack different body parts. So it's not like hundreds of different autoimmune diseases. It's just like one disease where you're attacking your own body parts, and it can happen any place. Thus, it's so easy to go from one autoimmune disease to 2, 3, 4, 5, adding new ones all the time. So it was actually in MS with one of the first times we were really understanding how this low-dose naltrexone can help people. So we use it on a vast majority of our patients. Also, there's some really interesting studies specifically about MS with what they call fasting mimicking diet. So this is a diet that mimics fasting, and Dr. Longo out of University of Southern California has been doing research for decades on all the blue zones around the world where people live really long, healthy lives. And he goes, what's the commonality here between all these communities? Well, fasting. And so he has figured this out so much that he has a program called the fasting mimicking diet, where you eat a certain way, real specific foods for 5 days each month for like 3 months, and you can get these profound positive impact on autoimmune disease, including MS. And in the mouse model, where they develop very similar mouse model that develops MS, basically, they're looking at this stuff and have done a lot of stuff, and new stuff's coming out just lately about the profound ability to reverse basically MS in mice with this fasting mimicking diet. But also that correlates with the data we already have about it helping people with MS. And if you can do it in the mouse, and it's a really good model of a certain human disease, there's a huge correlation. So this fasting mimicking diet, we use it for a lot of people because it's basically been shown also to have an impact on preventing heart attacks and strokes and Alzheimer's and diabetes and all this, as you would expect, because if you're addressing the autoimmune stuff, you're addressing everything else. But the fasting mimicking diet can be a real nice one where in the mice, for example, it's like 40%, don't quote me on this, like 40% of the mice actually get rid of the MS totally, and another like 40%, basically just don't have any symptoms, kind of a thing. And so it's really profoundly impactful. But then again, it just speaks to the body's ability to heal. If you give it the chance, you kind of get rid of stuff that's bugging it, you give it the stuff that it needs, your body can pretty much reverse anything.
Dr. Bielstrom, I have a few minutes left, and I wanted to try to get a few more questions in. We did have 3 questions about psoriasis that I know that you saw. Could you maybe talk to us a little bit about psoriasis? I know one person asked about taking their Humira shots. And I know actually the other one was how healthy guts affect autoimmune disorders, which you elaborated on earlier. And then again, with foods related to psoriasis. Could you maybe just speak maybe a minute or two about psoriasis?
Sure. So kind of back to, if you got a skin issue, you always wonder about the gut. So whatever the skin issue, what's going on with the gut? You fix what's going on in the gut, you fix the skin stuff. And so psoriasis is just an autoimmune disease that actually attacks the skin, even though you can see any number of skin issues, including acne, if there's gut issues and associated with this autoimmune stuff. So ideally, the same thing applies. All the autoimmune diseases are the same, just attack different body parts, is if you take care of the gut, you fix the vitamin deficiencies, you fix the hormone imbalances, you get rid of infections, you control cortisol, the stress hormone cortisol, you reset it into the non-fight or flight mode, into the relaxation mode, you're going to reverse pretty much any autoimmune disease, including psoriasis. And so there's not necessarily anything real specific we need to do to psoriasis. We just got to take care of the big picture. And the autoimmune disease, whatever it is, including psoriasis, should be in a great position to clear and go away, ideally. And then ideally not be in a position where you need those medicines, because now your body's fixed it. You don't need the help from the outside. You basically fixed your bullet hole, and you don't need the bandage on top of the bullet hole anymore.
Okay, and then another one that's just come in from a viewer on Facebook is from Amando A. Some of the supplements someone perhaps that you work with, some of the supplements you prescribe are not covered by Medicare. What can you and I do to encourage Medicare to cover these costs?
Oh, that is a great question. I think what you're kind of saying is, what can we do to encourage the whole insurance industry to do more for preventing chronic disease? We tend to be kind of reactionary, where you got a chronic disease because we didn't do anything to prevent it, and now we're going to put that bandage on there, but we're not really going to go after what actually caused the damage, the bullet hole. And so alleviating nutritional deficiencies, vitamin mineral deficiencies, has a really profound impact on the body. But if it's not a prescription medicine, it's just not typically covered by insurances, including Medicare. Even things that are prescription medicines, Medicare may not cover if it's a nutrient, a vitamin or mineral. And so there are supplements that are very helpful. Now, they don't tend to be the ones you can get easily over the counter. They just don't have the quality, and there's a lot of fillers in them that are problematic. So you really need ones that you either get online or through your local physicians that are the pharmaceutical grade supplements that are independently tested for purity and content. Nothing in them that bugs you. It has actually in it exactly what it's supposed to, just like the pharmaceutical industry has to do. And I think vitamin D is a good example of this, in that a lot of insurances are not covering vitamin D tests, whereas vitamin D is so profoundly impactful, including the ulcerative colitis. I wish I could have got into more detail about that ulcerative colitis situation in vitamin D and vitamin D receptors in the gut. But here's vitamin D. One of the recent videos I did was played around with a clinical situation where here's a woman that comes in with Hashimoto's, and she's been tested for vitamin D, and she was a 19, but the range was 20 to 80, and they said, well, you're a little low in vitamin D, but so you want to take it, you can. If you don't want to take it, you don't have to, but you're just a little low. Well, you actually have to be the 5 worst out of 100 to fall out of these reference ranges on the blood test. So she's a 19 out of the range. She's the 5 worst. She's an F. Well, you take that woman who's got a 19, and here's this beautiful study from, I think it was June of 2018. You take a woman less than 20 and you get her above 60, you will decrease her chance of getting breast cancer by 82%. You want to get somebody 100% no breast cancer, but 82% of the way there by doing one thing with vitamin D. And if every woman basically was above 60, because everybody's lower than they should be above 60, we'd have 82% less breast cancer. Same thing goes for preventing multiple sclerosis, preventing type 1 diabetes, preventing all kinds of chronic diseases. But, we just are not there as far as the prevention. We're just like, well, let's take care of it when it's there with a prescription medicine. I'm with you. I'm trying my hardest.
Actually, and our final question, Dr. Bielstrom, is related to thyroid, and I know that you saw this, and I just wanted to give you a chance to just briefly respond. We've gone over by a minute or so, but I just wanted to try to get to as many people. So I'm researching what books or options you recommend to educate myself. I'm currently reading Thyroid Reboot by Kinsey Jackson. Have you heard of this, or do you recommend?
Yeah, I can't.
Do you recommend?
Yeah, I can't say that I've heard that specific book, but there is a lot of great information about thyroid. And one reason there's so much information is so important. It gets thrown off so much because of cortisol. Cortisol really tends to throw off thyroid. And you just don't get the bang for your thyroid effort, whether you're making the thyroid hormones yourself or you're taking a thyroid medicine and you go, well, they said this should make me feel great because thyroid's a great mimicker. It can look like anything when the thyroid's off, and if we fix it, everything gets better. I'm not getting better. And so there's a question of, can I produce T4, which is the inactive thyroid hormone basically the thyroid makes. The other question is, once my thyroid releases this relatively inactive hormone, it gets in the bloodstream, it's got to go all over the body, like liver, kidneys, good bacteria in the gut. All these body parts have to turn into the usable kind of thyroid hormone called free T3, or it turns it into a get in the way dude called reverse T3. So when you get all this stuff going on, cortisol is a classic example. Excessive stress, it shifts the conversion from the stuff that makes you feel great, the free T3, to the stuff that gets in the way of everything, the reverse T3, and you still don't get your bang for your effort. And so a lot of the stuff that you're going to do to reverse this autoimmune disease is we're going to reverse that poor conversion, create calm, vitamin issues are taken care of, get rid of the infections, all this. You're going to become a great converter, and now you'll feel tremendous because your thyroid's in a good position, whether you're making it on your own or not, I might refer you to, I did 4 consecutive blog posts about this situation and got into really big detail about how important thyroid is, but also why you may do blood tests and be told, oh, your thyroid looks fine, when it's far from fine, or here's this medicine and you're gonna feel great and you don't feel great, why exactly that is, because it is such an important topic.
Okay, and I'd just like to circle back to Jody. Jody, I'd like to really thank you very much for being here today and talking about your profession and about adverse childhood events. In closing, is there anything that you also wanted to say or elaborate on that you haven't had a chance to talk about today?
Well, I just want to conclude with saying I think it is very important. I know my husband does this in his clinic, but it's very important that the medical community realize that to treat medical complications, medical illnesses, symptoms, they really need to look at the mental health issues as well. Being able to intervene and help with stress management and managing depression is very, very important. I think it's a piece that continues to need a voice in the medical community as far as being able to help others with chronic health issues and so that they aren't sabotaging their own health because they haven't dealt with their stress. So very important to remember that mental health issues have to be addressed when dealing with physical issues.
Okay, can I say something about that, Michael, please?
Sure, Dr. Bielstrom.
So Cleveland Clinic started the first functional medicine program associated with the teaching hospital, and we're the second. We're the only one still west of the Mississippi. And in Cleveland Clinic, when they opened their clinic, everybody had to see the nutritionist. When we opened our clinic here, everybody had to see Jody. Everybody has to see the mental health worker, because if you do not manage stress well, you do not address these adverse childhood events, you do not reset your cortisol, everything else we do is just almost impossible to get the bang for your effort. You got to reset that cortisol. You got to fix that stuff if everything else you do is going to have the full impact that you want it to have.
Well, that's fantastic, and I think that's a really good note from both of you to end this webinar on. I would very much like to thank Dr. David Bielstrom and Jody Bilstrom for being with us today. Please know that they see patients in Blackfoot and Blackfoot, Idaho. And again, their phone number on the screen is 208-782-2444. And I would like to thank all of our viewers and everyone who has participated in this webinar today. This has been very successful, and I think we could keep talking about this topic for many hours. So maybe we'll invite Dr. Bielstrom and Jody back to kind of dig a little bit deeper into autoimmune disease and reveal the more information that's being discovered every day. At this time, I'd like to sign off and wish everyone much happiness, health, and safety. Thank you for being with us today.